Së pari, we welcome to our international participants, and I've given the floor to our main organizer of this conference, Professor Melissa Perry from the George Mason University. And Melissa, you are doing a presentation on the introduction to the conference. Please.
Mirëmëngjes. Përshëndetje. Unë jam shumë e lumtur që ndodhem këtu midis jush me kolegjit e shkencës, shëndetit publik edhe të mjekësisë. Faleminderit që jeni këtu edhe jam shumë e nderuar që ju keni shpenzuar kohën tuaj të çmuar. Unë dëshiroj të falenderoj akademinë, grupin organizator edhe të gjithë prezantuesit për punën e madhe që kanë bërë për të zhvilluar këtë takim të rëndësishëm. Do të dëshiroj që këtë temë të prezantojmë në shqip, sepse e konsideroj shqipen si gjuhë shumë të bukur. Gjithmonë unë jam duke mësuar shqip, por nuk mjafton që të bëj këtë prezantim në këtë gjuhë. Shpresojmë që një ditë do të jetë e mundur të bëj këtë. Thank you so much for being here. Really, really delighted. Really delighted. I have just a few more remarks in English. Ladies and gentlemen, distinguished guests, esteemed scientists, and esteemed colleagues, on behalf of the organizing committee, it's my great pleasure to welcome you all to the second annual Scientific Conference on Environmental and Public Health, held here at the prestigious Albanian Academy of Sciences. Today, we gather here to explore the critical issues surrounding the health and well-being of individuals in relationship to their environments and their workplaces. This conference represents a remarkable opportunity to foster collaboration, exchange knowledge, and address the challenges faced by our global community. We're honored to have in our midst a diverse gathering of experts from the United States, from Europe and Albania, representing a rich tapestry of perspectives and experiences. Environmental and occupational health remains a pressing concern in today's world. As our societies continue to evolve and develop, it is imperative that we acknowledge and address the potential risks and hazards that accompany progress. The impact of environmental factors on human health, as well as the effects of occupational conditions on workers' well-being, cannot be overstated. In Albania, a country known for its breathtaking landscapes and rich cultural heritage, we face our unique set of environmental and occupational health challenges. It's our responsibility to safeguard the health and safety of our citizens, as well as protect the integrity of our natural resources. Through this conference, we aspire to engage in fruitful discussions, share best practices, and seek innovative solutions that will contribute to the well-being of our people and the sustainability of our environment. The theme of this conference, Water and Air Quality Control, Protecting Human Health and Ensuring Sustainable Development, reflects our commitment to long-term solutions that prioritize the health of both individuals and the planet. By fostering interdisciplinary collaboration and promoting evidence-based research, we aim to advance our understanding of the intricate relationships between human health, environmental factors, and occupational conditions. Throughout the course of this conference, we've curated an exceptional lineup of speakers and presenters who will shed light on a wide range of topics, from the impact of air pollution on respiratory health to the promise of new environmental technologies. We're poised to gain valuable insights and build networks that transcend borders and disciplines. We'd like to express our deepest gratitude to the Albanian Academy of Sciences, to my dear colleague, Dr. Genci Solçebe, to Dr. Bestek Barai, to the entire organizing committee and all of the staff, and to our president of the Academy, Dr. Skender Janushi, for graciously hosting this event, as well as to our sponsors and supporters for unwavering commitment to environmental and occupational health. In closing, I encourage each and every one of you to actively participate, engage in fruitful discussions, and forge new connections that will fuel progress in the realm of environmental and occupational health. Let us harness the power of collaboration to confront the challenges before us and work together towards a sustainable future that ensures the well-being of both current and future generations. Thank you, and may this conference be a catalyst for transformative change. Thank you.
Faleminderit Melisa, dhe tani paftoj kryetarin e Akademisë së Shkencave, profesor akademik Skënder Gjinushi, përshëndesi hapjen e kësaj konferencë.
Mirëdita, përshëndetje të gjithëve. Duke uruar mirëseardhjen në ambientet e Akademisë së Shkencave, dëshiroj së pari të falenderoj, përshëndes organizatorët për këtë aktivitet, për këtë konferencë mjaft të rëndësishme, e cila na vetë tematika e saj tregon edhe rëndësinë që ka pra problemet të shëndetit publik të lidhura këto me ajrin, ujin edhe diellin ngelet, pra për me pastërtinë e ajrit dhe të ujit. Tashmë është e mirënjohur se sa të lidhura janë këto me njëra tjetrën dhe se sa probleme kemi ne edhe në vendin tonë në lidhje me këto çështje. Kështu që qëllimi i parë i këtyre konferencave është patjetër që të bëjmë bashkë specialistët e fushave përkatëse në një debat të hapur shkencor, dhe këtu patjetër përgëzoj, falenderoj bashkëpunimin e ngushtë që është krijuar me shkollat e larta, me universitetet Tiranës, Universitetin Bujqësor, ku e kemi kapur na koka se rektori është pjesë e Akademisë së Shkencave, dhe ku tashmë njësitë tona, qoftë Komisioni i Shëndetësisë apo njësia Biogenetikës, punojnë si një trup. Pra gjithë qëllimi dhe kryesor përse i mbështesim këto aktivitete nuk është vetëm pra ky krijimi i debati shkencor e bashkëpunimit të specialistëve, por është edhe krijimi i një federalizmi, do thosha, në kërkimin shkencor, ku institucionet duhet bashkëpunojnë me njëri tjetrin dhe konkurenca apo gara duhet jetë vetëm në nivelin shkencor dhe jo në aspekte të tjera. Pra sepse politikat e mbyllura apo izolacioniste, si mund t'i quajmë, absolutisht nuk shkojnë në atë drejtim që po ecën shkenca sot, që me inteligjencën artificiale ka kalu çdo kufi. Kështu që prandaj dhe ne përgëzojmë këtë fakt, tashmë njësia biogenetikës, e cila kërkojmë që pikërisht jetë një ndër koordinatorët e kërkimit shkencor në këto fusha, së bashku me njësinë e ujrave, së bashku me komisionet përkatëse, është duke hedhur shtrat, dhe ne jemi në kohën kur kërkimi shkencor duhet mbështetur fuqish. Pra jemi në një periudhë ku Shqipëri nuk duhet pyetur a duhet investu në kërkim shkencor, por duhet investu me hop. Pra duhet bëjmë një kalim të madh, sepse jemi në kushtet ku pos ka përgjën këtë grop potenciale mund të shkojmë mbrapa. Pra rrjedhimisht tashmë ambicjet tona, ose më saktë janë dhe detyrime, se jemi në fazën e antarësimit të Shqipërisë, ku një nga kapitujt e diskutueshëm është pikërisht kapitulli për shkencën, dhe ku kërkohet që dhe Shqipëria të ketë njëjta standarde në arsim dhe në shkencë, të cilat kemi thënë, do e themi vazhdimisht që ecim vetëm së bashku. Pra ecim vetëm së bashku. Dhe theksoj këtë sepse jo gjitha sferat politike e kanë këtë qasje ndaj kërkimit shkencor, e kanë këtë vlerësim ndaj kërkimit shkencor. Madje shkohet deri aty sa që edhe këto hapa të para përpjekje që bëhen për ngritjen e kërkimit shkencor të anatemohen. Dhe është e mirë që i dështuari nuk duron dot suksesin e të tjerë. Ky është një parim dhe aq më tepër pastaj në politikë kjo është shumë fisht dhe reflektohet edhe në sferat e tjera. Prandaj një nga gjërat për të përgëzuar është dhe mbështetja e ekzekutivit, përshëndes prezencën e zëvendës ministres, sepse problemet që mund ngrej shkenca, problemet që mund ngrej shkenca, do mbeten letër pa një bashkëpunim me organet ekzekutive, pra të mbështet shkenca duke investuar të, dhe ajo duhet ndihmoj pastaj në zgjidhjen e problemeve të përbashkëta. Pra ne jemi në këtë fazë, jemi në fazën që duhet të bëjmë një hop. Rruga e nisur është për së mbari, prezenca vetë e specialistëve që janë këtu dhe gjithë konferencat që janë zhvilluar kanë treguar që potencialet në Shqipëri ekzistojnë, pra me gjithë probleme që shkakton ikja e trurit, përsëri nuk kemi mbet pa trufare. Pra, rrjedhimisht ekzistojnë kapacitetet për të ngritur celulat, për të ngritur strukturat në mënyrë që të thithim dhe atrush që ka ikur. Pra dhe një nga politikat që ndjek akademia është pikërisht hapja ndaj diasporës, ku ka potenciale shumë të mëdha, dhe tashmë ardhja ka një favor, sepse s'është e thënë të vim fizikisht, mjafton të bashkëpunohet menderisht, po themi, nëpërmjet sepse puna online tani është bërë paqe suksesshme, paqe mundshme. Kështu që uroj që pikërisht kjo konferencë t'japi një kontribut, dhe do t'japi kontribut më tej, dhe me këtë rast falenderoj veçanërisht profesor Melisa Peri dhe George Mason University që tashmë ka vendosur një bashkëpunim të ngushtë, sepse njësitë tona të reja kanë nevojë për përvojë më të avancuar, më të përparuar, dhe ka nevojë edhe pikërisht për treguar këtë dhe sa mbrapa jemi dhe se ku duam të shkojmë. Faleminderit dhe sukses.
Faleminderit profesor Gjindrushi për fjalën tuaj, për përshëndetjen dhe për mbështetjen që i bëni punës kërkimore, pa të cilën gjithë kjo aktivitet kërkimor në Akademinë e Shkencave nuk mund të realizohej. Dhe më lejoni që të ftoj zonjën Almira Xhamballa nga zëvendës ministër e Ministrisë së Mjedisit dhe të Turizmit për një fjalë përshëndetëse.
Shëndetje të gjithëve, i nderuar presidenti i Akademisë Shkencave, zoti Gjinushi, i nderuar doktoresh Peri, përfaqësuese e Kolegjit të Shëndetit Publik të Universitetit George Mason, i nderuar doktor Frank, i nderuar rektor i Universitetit Bujqësor, të nderuar përfaqësues akademik, koleg, profesor të mirënjohur. Është realisht një kënaqësi dhe shumë faleminderit për ftesën se ndjem e nderuar, veçanërisht si përfaqësuese e Ministrisë së Turizmit dhe Mjedisit, të jem pjesë e këtij diskutimi kaq interesant, e këtij eventi ndërkombëtar që adreson pikërisht çështjet më kritike në momentet që flasim dhe në dinamikat e zhvillimit, jo vetëm në Shqipëri, por edhe në rajon edhe më gjerë, atë të mbrojtjes së shëndetit të njeriut, që e vë theksin në rolin e domosdoshëm të akademitëve përballë kësaj sfide globale urgjente, garantimit cilësisë ajrit dhe të ujit për një zhvillim të qëndrueshëm dhe të ardhme më të shëndetshme. Në fakt, ajri i pastër është thelbësor sa i takon shëndetit të njeriut. Megjithatë, ndotja e ajrit mbetet një nga rrezikjet më të rëndësishme në mbar botën, ndaj përpjekjet për të hetuar dhe për të hulumtuar drejt cilësisë së ajrit dhe mjetet e lidhura me mbështetjen shkencore kanë një rëndësi teje të veçantë sa i takon përmirësimit të cilësisë së tij dhe në një kuptim për të kuptuar dhe mitiguar ndikimin e ndotjes mjedisore në shëndetin tonë. Qeveria shqiptare që për vitin 2015 është e angazhuar në vijimin e planeve dhe projekteve për t'i bërë realitet 17 objektivat për zhvillimin e qëndrueshëm. Dhe në një kuptim kjo konferencë lidhet drejt për drejti me dy nga objektivat kryesor të kësaj agjende, atë që ka të bëjë me sigurimin e jetesës së shëndetshme, duke promovuar mirëqenien, dhe objektivin e zhvillimit të qëndrueshëm numër 6 që ka të bëjë pikërisht me sigurimin e qasjes dhe menaxhimit të sigurt të ujit, por edhe të higjienës për të gjithë. Por ajo çfarë është më e rëndësishme, që u përmend edhe në fjalën e presidentit, ka të bëjë pikërisht me forcimin e partneriteteve dhe puna e përbashkët është shumë e rëndësishme dhe sot më e rëndësishme se kur për të mbrojtur shëndetin dhe ekosistemit nga ndotja e ajrit, por edhe për të arritur objektivat e zhvillimit të qëndrueshëm. Prandaj, duke qenë që ne ndajmë të njëjtin ajër dhe ndocit, siç ju e dini shumë mirë, nuk kanë kufi, ne duhet të gjejmë dhe të punojmë për zgjidhje të përbashkëta, të ndërveprojmë me të gjithë sektorët, në të gjitha nivelet, qoftë në nivelin urban, në nivelin kombëtar apo ato ndërkombëtar. Ndaj, realisht ju përgëzoj për këtë event dhe në një kuptim është shumë e rëndësishme dhe sa herë gjej rastin falenderoj që edhe Akademia e Shkencave i ka sjell çështjet e mjedisit në këto nivele kaq të larta diskutimi, ku ne kuptim shumë të interesuar sa i takon të gjithë kontributit tuaj shkencor dhe si ne mund ta përdorim në mënyrë efikase dhe eficiente gjithë këtë njohuri të niveleve më të larta sa i takon ndikimit dhe mitigimit të gjithë problematikave për patur një mjedis më të mirë, por gjithashtu është shumë e rëndësishme që ju sillni dhe vijoni të bashkëpunoni me universitete ndërkombëtare të niveleve më të larta. Në fakt, Ministria e Turizmit dhe Mjedisit sidomos gjatë viteve të fundit, ndihet optimiste sepse niveli sensitivitetit edhe të qytetarëve dhe të gjithë grupeve të interesit sa vjen edhe bëhet më i lartë dhe ka një shkëmbim proaktiv informacioni, duke qenë që qytetarët janë në një kuptim shumë të interesuar sa i takon të drejtës së tyre për të patur një ajër të pastër. Ministria e Turizmit dhe Mjedisit, duke patur parasysh fushën e përgjegjësisë së saj në kuadër të mbrojtjes së përmirësimit të cilësisë së ajrit, ka ndërmarrë disa iniciativa sa i takon edhe përmirësimit të kuadrit ligjor. Nisma më e fundit që do të kalojë edhe sot në Kuvendin e Shqipërisë ka të bëjë pikërisht me ndryshimet për ligjin për mbrojtjen e cilësisë së ajrit, që ka si qëllim pikërisht forcimin e masave administrative në rast kundravajtjesh, duke rritur kundravajtjet administrative me 30%, duke sjellë edhe një herë në vëmendje rëndësinë që ka mbajtja e mjedisit pastër, përmirësimi i cilësisë së ajrit, edhe duke ju referuar të gjithë treguesve në bazë të monitorimeve që bëjmë dhe raportojmë Agjencia Kombëtare e Mjedisit, por edhe tek në Agjencinë Europiane të Mjedisit, dhe duke patur parasysh dinamikat e zhvillimit, zhvillimin urban, transportin, ndërtimet, sektor të cilët ndikojnë drejt për drejti në cilësinë e ajrit, na duhet që të jemi të kujdesshëm për të zbatuar ligjin dhe për të zbatuar atë parimin ndot si paguar. Dhe gjithashtu një tjetër nismë që është shumë e rëndësishme sa i takon çështjeve të cilësisë së ajrit, që lidhen drejt për drejti me kompetencën e Ministrisë së Turizmit dhe Mjedisit, për të forcuar pikërisht bashkëpunimin ndërregional mes pushtetit qendror dhe atij lokal, është edhe një nismë nëpërmjet një urdhri të kryeministrit për ngritjen e një grupi pune për cilësinë e ajrit, i cili do të drejtohet nga Ministria e Turizmit dhe Mjedisit dhe do të ketë përfaqësues jo vetëm nga ministrit e linjës, por edhe nga institucione të tjera dhe nga përfaqësues nga akademia. Ndërkohë që duke mos dashur që të zgjatem shumë dhe dua ta lidh pak edhe me sfidën që ka Shqipëria përpos dinamikës së zhvillimit të sektorit të turizmit, ku na duhet për të patur një turizëm të qëndrueshëm, të jemi shumë të kujdesshëm për të mbajtur këtë ekuilibrin mes turizmit dhe mjedisit, të tregojmë të kujdesshëm për të përmirësuar treguesit e mjedisit, sepse vetëm në këtë mënyrë mund të thithim edhe turist elitar, që të jemi, le të themi, pozitiv dhe dinamik, jo vetëm në shifra, por edhe në cilësi. Na duhet që të punojmë me cilësinë, qoftë cilësinë e ujrave, cilësinë e ajrit, apo në të gjithë treguesit e mjedisit në përgjithësi. Në fakt, unë jam edhe negociatore e kapitullit 27, edhe ju përmendët edhe kapitujt të tjerë që Shqipëria përballet në këtë sfidën për integrimin në Bashkimin Evropian, por besoj që kapitulli 27 që ka të bëjë me ndryshimet klimatike dhe mjedisin është një nga kapitujt më sfidues dhe në kuptimin e asaj që kërkon jo vetëm angazhim të strukturave apo investime burime njerëzore, por ajo çfarë është më e rëndësishme ja kërkon investime financiare që deri diku duken edhe pak të papërballueshme për buxhetet tona, prandaj na duhet ky bashkëpunim dhe ky ndërveprim për të përmirësuar në një kuptim të gjithë punën dhe për ta çuar në një dimension tjetër. Dua të them edhe diçka që lidhet edhe me menaxhimin e ujrave, duke qenë që nuk është ne si Ministria e Turizmit dhe Mjedisit jemi të fokusuar pak në cilësinë e monitorimit të ujrave larës kryesisht që lidhen drejt për drejt dhe me zhvillimin e sektorit të turizmit, por gjithashtu në konceptin e menaxhimit të ujrave në përgjithësi, Agjencia Kombëtare e Menaxhimit të Burimeve Ujore është një tjetër agjenci e cila drejt për drejti merret me këtë fokus dhe kur vije puna tek zhvillimi i qëndrueshëm, lejoni të them që përveç një pune kolosale që është bërë për transpozimin e të gjithë direktivave sa i takon sektorit të ujrave, më vjen mirë që këtë vit është përmbyllur ky kapitull sa i takon transpozimit të legjislacionit dhe ka vijuar puna për hartimin e të gjithë planeve të menaxhimit për bazenet e lumeve më të rëndësishëm dhe nga ana tjetër punohet në një kuptim shumë përpjekje ndërinstitucionale për të arritur që të kemi realisht një adresim sa më gjithë përfshirës të gjithë sektorëve që çojnë në një mjedis më të mirë, më të pastër, që ka si objektiv kryesor përmirësimin e shëndetit të brezave të tanishëm dhe brezave të ardhshëm, por edhe zhvillimin e qëndrueshëm ekonomik të vendit. Prandaj ju falenderoj që gjithmonë i sillni këtë çështje në këto nivele diskutimi, jemi të angazhuar për të bashkëpunuar me ju dhe besoj që vetëm duke hartuar politika të mira, të forta, por nga ana tjetër duke synuar në implementimin dhe zbatimin e tyre, ne mund të mbrojmë mjedisin, mund të garantojmë një ajër të pastër, një ujë të sigurt dhe një të ardhme të qëndrueshme për veten edhe për brezat që do të vinë. Shumë suksese me konferencën e sotshme dhe faleminderit për gjithë angazhimin tuaj shumë elitar sa i takon çështjeve të tilla. Suksese.
Shumë faleminderit zonja zëvendës ministre për fjalën përshëndetje dhe për sensibilizimin këtij mjedisi shkencor dhe për vënien në dijeni të këtij mjedisi, pra që është preokupim parësor i qeverisë për mbajtja dhe përmirësimi i mjedisit, që është një objektiv shumë i rëndësishëm dhe për të cilin është fokusuar konferenca e sotme. Dhe nëse më lejoni tani të ftoj doktoresh Eugena Tominit për 2 fjalë përshëndetse në emër të Institutit të Shëndetit Publik.
I nderuar presidenti i Akademisë së Shkencave, të nderuar akademik, profesor, kolegë të nderuar, jam e nderuar dhe unë sigurisht në këtë konferencë së dytë të shëndetit publik në drejtim të sigurisë së ujit, cilësisë, por edhe të ajrit, element tepër të rëndësishëm që ndërthuren jo vetëm në kuadër të një mjedisi cilësor të qëndshëm, por edhe në kuadër të faktorëve vlerësimit faktorëve të riskut, në drejtim të vlerësimit të një ujë të sigurt, jo vetëm ai i pishëm, por edhe ujrave sipërfaqësor, ujrave larës dhe për mëtej. Në këtë kuadër e shikoj me shumë interes pjesëmarrjen edhe të Institutit të Shëndetit Publik, si një ndër institucionet e varësisë të Ministrisë së Shëndetësisë, duke përcaktuar disa nivele, jo vetëm shkencore, por edhe atributet bashkëpunimit me gjithë njësitë vendore të kujdesit shëndetësor në drejtim të një vlerësimit të faktorëve të riskut për sa i përket ajrit, në bashkëpunim edhe me ministrit respektive, ashtu si kundër zëvendës ministre e mjedisit e përmendi, por edhe në kundrejt gjithë ndërhyrjeve që janë bërë nga qeveria për sa i përket vlerësimit të këtyre faktorëve ndërlidhës për një jetë sa më të shëndetshme. Sigurisht, ndërthurja e vlerësimit të faktorëve të riskut për sa i përket ajrit edhe ujit janë element të rëndësishëm, të cilat me anë të studimeve, vlerësimeve shkencore që dhe kjo konferencë do të paraqesë, si kundër dhe ekspertët e Institutit të Shëndetit Publik që janë pjesë e agjendës sotme, do të reflektojnë nesër politika jo vetëm mjedisore, por edhe shëndetësore, për të patur një qëndrueshmëri mjedisore, por edhe të shëndetit. Ju falenderoj shumë edhe faleminderit për ftesën.
Faleminderit Eugenia për shëndetjen. Dhe tani, please allow me to invite Professor Frank from Collegium Ramazzini to make a greeting for this conference and to introduce also the Collegium Ramazzini to the public. Thank you. Thank you.
Thank you, Jetsi. Good morning. It is my privilege to send greetings from the president of the Collegium Ramazzini, Dr. Melissa McDermott, who was very active in this conference last year, but asked me as one of the longest serving members. I've been a fellow of the Collegium for over 40 years now, to send her greetings. The Collegium is an organization of 180 active scientists and physicians from literally around the world, from 40 countries, that are devoted to the betterment of the work environment and the environment in general. It's headquartered in Carpi, Italy, which is the home of Bernardino Ramazzini, whose name graces the organization. He wrote the first textbook on occupational medicine in the year 1700, and we think of him as the father of our field in occupational medicine. So that is briefly something about our organization. And we have a number of fellows, both here present, who will be interacting with you, and a number of speakers who will be coming online later. But Melissa asked me to send her greetings, and she says, on behalf of the 180 fellows of the Collegium Ramazzini who come from the more than 40 countries, she sends her warm greetings as we start our second collaborative conference here in Albania. She recalls the excellent presentations and the warm hospitality of last year's meeting, and she's pleased that there is a desire to continue to work together to advance our shared mission in environmental and occupational health science, protection, and advocacy. And she says, please be assured that the Collegium is committed to a vibrant collaboration as you explore together over the next days opportunities for shared work. And she wishes us well for our conference and our success. On a personal note, for me, this is my first visit to your wonderful country here in Albania. I had some opportunity yesterday to see some of the area around Tirana. And as we drove around the city late yesterday, we noticed the spacing on one of the boulevards of the Albanian flag with the American flag. And I learned that it is a custom here to hang other countries' flags on a regular and rotating basis. I come from the city of Philadelphia, where on one of our main boulevards, we have hundreds of flags of countries from all over the world hanging. So I'm used to seeing that, but it was especially important for me to see that yesterday, and to know that it was the American flag, understanding that just as November 26th is important to you for your independence, today is July 4th, which in America is our Independence Day. And so it was very relevant to see the flags and to know that it was this time every year that the American flag hung out. And so we share with you the importance of being a free and independent country. And so on a personal note, I'm delighted to be here and look forward to meeting many of you and interacting and sharing some of the science that I've been doing. So thank you very much.
I'm inviting Professor Lika to take the chair, and also Professor Mellolari.
Morning. Good morning, dear members of Academy of Science, distinguished guests, colleagues, researcher, professor. I'm honored to moderate with Professor Malolari this first session of this conference as a second annual meeting in the public health and environmental field. So let's start with the first session of this conference with the current perspective on air quality. And I have the pleasure to invite Professor Gens Sulcebey for his presentation on impact of air and water pollution of immune-mediated disease, a literature review and comprehensive analysis. Professor, the floor is yours.
I thank the organizer of this conference and particularly Professor Perry for giving me the first floor in this conference. And with this presentation, I have trying to make a literature review about the impact of air and water pollution on, in general, in human diseases and particularly on immune-mediated diseases. It is well known that air and water pollution are global challenges with a high impact on people's health. And despite their known role in cardiovascular and respiratory diseases, recent evidence shows an important role of these pollutants also in immune-mediated diseases. And it is known already that individuals exposed continuously to high level of pollution are at an increased risk of immune-mediated diseases such as allergies and autoimmunity. Air and water pollutants share common mechanisms for developing immune-mediated diseases, but also have differences in this regard. Air pollutants are inhaled and directly affect the lung-associated immune response. And water pollutants are ingested or can enter the body through the skin, affecting the gastrointestinal-associated immune response. Air pollution in Europe is top single environment health risk, significantly contributing to premature death. The European Environment Agency has identified fine particulate matters with a size inferior to 2.5 micron as a cause of health impact. Increasing levels of CO2 and particulate matters added to environmental stressors such as wildfires, flooding, extreme weather, make people more susceptible to allergies, asthma, and other immune-mediated diseases. The World Health Organization has provided evidence of links between exposure to air pollution and type 2 diabetes, obesity, systemic inflammation, Alzheimer's disease, and dementia. Also, the International Agency for Research on Cancer has classified air pollution, and particularly the PM with the size inferior to 2.5 as a leading cause of cancer. According to state-of-the-art reports, air pollution exposure may contribute to cardiovascular diseases and cancer risk by interacting with various common risk factors such as inflammation, oxidative stress, and epigenetic modification. There are some effects considering the different pollutants, air pollutants, in all the systems in organisms. For example, Sulfur dioxide is known that is related with headache and anxiety. The particular matters are related with impacts on the central nervous system. Dioxide nitrogen affects irritations and inflammations and infection also. Asthma and reduced lung function is correlated to these problems. PM sizes with sizes inferior to 2.5 are related and also inferior to 10 microns are related with chronic obstructive pulmonary disease, also with lung cancer. And there is also a relation of all these pollutants with irritations of eyes, nose, and throat, and with breathing problems, of course. And together, the particulate matters, the ozone, and the sulfur dioxide are related also with cardiovascular diseases. And they have also impacts on liver, spleen, and blood also. And also there are studies correlating the particular matters inferior to 10 microns with a reproductive system, with a diminution of fertility in males. Also, there are different problems related to human exposomes, and such as pollens, greenhouse gases, air pollution, outdoor and indoors, chemicals, mold exposure, and migration to urban areas also, and the modification of biodiversity, the access, the differences in access to diverse nutritious sources, and different exposures to microbial diversity are related to allergic diseases such as asthma, allergic rhinitis, conjunctivitis, dermatitis, eosinophilic esophagitis, food allergies, different oral allergies syndromes, and also venom allergies. They are also related with autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease, and multiple sclerosis. And also there are proofs, scientific proofs of a relation between these factors and also cancers, such as colorectal cancer and lung and other type of cancers. And urbanization. There are many scientific reports that relates the industrial activities such as smoke and different affluents, ongoing construction, vehicle emissions, with in addition to higher population densities, noise pollution, social inequalities, psychosocial stressors related with chronic stress, dysregulation of immune cell function and immune system in general, chronic low-grade persistent inflammation, and different immune-mediated diseases. The principal pollutants of air pollutants are particulate matters, and particularly particulate matters with a size inferior to 2.5 microns that have the possibility to penetrate the bronchial mucosa and to be captured for different macrophages in the alveolar macrophage and dendritic cells, and interacting with T cells and other pathways, immune pathways that can induce respiratory problems and can induce chronic inflammation that can result in different diseases, including also cancers. And third, pollutants, important pollutants. The second was also nitrogen dioxide. This is very important. It's exhausting from vehicles. And this is important pollutant known for exacerbating asthma, in asthma and other respiratory diseases. Ozone also is known with experimental works as an influence on phagocytosis, diminishing phagocytosis, and increasing production of cytokines, and producing also inflammatory, chronic inflammation, with also alteration of messenger RNA. And sulfur dioxide also is important pollution that can affect the inflammatory phase with producing inflammation, producing an important chronic immune response with a disbalance between the Th1 and Th2 cells, with they're producing problems related to allergic disease, such as asthma, for example. And at last, there are also the volatile organic compounds, such as benzene, formaldehyde, toluene, that can produce, is experimentally has been shown that it can produce an inflammatory response with apoptosis of the cells that can release autoantigens that are captured from antigen presenting cells, neutrophils that can activate neutrophil activation, and different pathways of innate immune system, or also adaptive immune system, producing chronic inflammation with different impacts in different organs. There is already well known that Western style of life, with small family sizes, affluent urban homes, intestinal microflora, stable and limited, high antibiotic use, low or absent helmet burden, and good sanitation in general, and low oral fecal burden, they enhance allergic disorders, allergic disorders such as asthma, eczema, and rhinitis. This is in contrast with developing countries with large family sizes, living in rural homes, with intestinal microflora very variable, and with low antibiotic use, and with high helminth burden and poor sanitation. They have a much lower prevalence in allergic diseases. And this is the hygiene hypothesis that is supported from several studies, many studies, that, and also epidemiological studies, that the high level of hygiene, is related to increased burden in pollens and mites, and there is disbalance between Th2 and Th1 T cells, and Th2 favor the allergic diseases, and the high level of hygiene favors the high prevalence of allergic diseases that we see indeed. And there are studies in all the world, also here in Albania. Professor Alfred Priftani has worked in this field. And we see a march of allergic diseases in the last 30 years. In the last 30 years, a very high increase in the level of allergic diseases. There are yet no studies about the autoimmune diseases, but there are many proofs that also autoimmune diseases are becoming more prevalent due to this change in environment. And this is the hygiene hypothesis that proposes that reduced early life exposure to germs and microbes may contribute to an increased risk of allergies and autoimmune diseases due to a less trained immune system. And there are also problems related to the pollutants in the water. It is known now that the heavy metals such as lead, cadmium, arsenic, mercury, nickel, manganese, copper, and zinc, all of these heavy metals can suppress the immune system, can inhibit lymphocyte proliferation, macrophage phagocytosis activity, and also cytokine production. They can decrease immune tolerance and increase chances of infections. They have genotoxic effects by damaging DNA, altering cellular signaling pathways, resulting in immune-mediated disorders and also cancers. Other known water pollution are organic compounds in the water. They can weaken immune surveillance mechanisms by impairing the phagocytic activity of macrophage and suppressing the cytotoxic activity of NK cells, known for their important role in detecting and eliminating infected and tumor cells. Pesticides can also act as haptens for allergy sensitization to develop or exacerbate autoimmune diseases. And also there are many problems with wastewater effluents that can, with their chemical mixture inside, and is proved experimentally in the blood, and also with experimental work in peripheral polymorphonuclear cells and in whole blood, that they can generate a decrease in lymphocyte activation and in an increase in basophils activation, with many impacts on the health in general. And last communication that you have seen in the literature about correlation between the level of the lithium levels in the drinking water and a higher risk of autism diagnosis. This is a report, article appeared in JAMA in 2023 about a very good conducted epidemiological study in Denmark with many thousands of pregnant women that have seen, that have detected epidemiologically that there is a correlation between the level of lithium in the drinking water and the prevalence of the autism diagnosis in this population. And at least we can give some recommendation, perhaps, that can be implemented for that takes decision in this field, that the management of air and water pollution are in relation with immune-mediated diseases is an evolving field that must be managed better managed. And there are research and understanding in this field. There is a must for increased focus on understanding this mechanism by which pollution can influence the immune-mediated diseases, including better specifying pollutants and their pathways of action, there is a need for larger and better conducted epidemiological studies, large-scale longitudinal studies to establish stronger association between pollution exposure and the incidence or exacerbation of immune-mediated diseases. There is also a must for policy, better policy and regulation with stricter standards and stricter air and water quality standards to be implemented to limit exposure to known pollutants, a better need for better global cooperation, enhancing international cooperation to address transboundary pollution issues, as pollutants is known can travel long distances. Regulatory updates are also needed, updates to regulation based on the latest scientific findings to ensure that they remain relevant and effective. Thank you for your patience. Thank you.
Thank you, Professor. Thank you very much for bringing to us all these important aspects of literature regarding the environmental pollution as a main component in development and in causing a lot of disease, and especially of immune-mediated disease. Thank you again. And now let's go forward with the second presentation of this session, community exposure to asbestosis. I have the pleasure to invite Professor Dr. Arthur Frank from the Drexel University, Philadelphia, USA. Professor, the floor is yours.
Thank you very much for the introduction, and that was a wonderful outline of all of sort of air pollution and water pollution issues to start us off at this conference. But I'm now going to focus on just one of those materials that ends up in both air and water, something that I've spent more than 50 years of my career studying. And that is the hazards of asbestos, which is a rather ubiquitous material around the world. So for those that may not be entirely familiar, asbestos is a commercial term that refers to 6 different naturally occurring minerals. Naturally occurring, they're not made by man, they're found in the ground. 5 of them are what we call amphiboles. They are chemically one different from another. The amphiboles are somewhat straight and needle-like in their presentation under the microscope. And collectively, only 2 of them have been commercially important and have only represented about 5% of all the asbestos used in the world. The most common form of asbestos is the serpentine or white asbestos. It gets its name because under the microscope it looks curvy like a snake or a worm might look, so it gets the name serpentine. We have here, let's see if I can, here is an asbestos body. It's a fiber that's been coated with iron and protein. And it's from a piece of tissue from an autopsy done in the year 1899. Dr. Montague Murray, working at the London Hospital at the East End of London, had a patient who was a 36-year-old gentleman who reported to Dr. Murray that he was one of 10 young men who had started working in an asbestos factory at the East End of London. And he reported that he was the 10th and last one to die. 9 of his buddies, 9 of his colleagues had preceded him, and they all had died of respiratory insufficiency. So the problem of asbestos, as you'll see with a quote of Dr. Murray's a little later, is not a particularly new problem. Dr. Murray didn't know what to make of this structure. He called it a curious body. It didn't get the name asbestos body for about another 20 years or so. The world production of asbestos, which is still quite common, is 1.2 million tons. Half of it comes from Russia. Other mines are in Kazakhstan. The Chinese still mine it. The major mine of the world, which was the Canadian chrysotile mine, and 95% of the world used the white or chrysotile or serpentine asbestos, is now closed. The Brazilians have closed their mines. In Colombia, where they had a mine, that's been closed. So most of the world's asbestos still comes from Russia. And the World Health Organization has estimated that around the world, of the 125 million individuals that are still exposed to asbestos, about 250,000 asbestos-related deaths still occur every year. So it's a continuing and serious problem. About 70 countries have totally banned the use of asbestos. Not, however, my own country, the United States. We are still lagging behind. We just put some new regulations in place, but they are being fought in court as regulations banning it were fought in 1989. So there's no guarantee that this will actually go through, especially with some new rulings from our Supreme Court just last week. They put in some new restraints on use, but it's not a totally banned material. And under the previous administration, while there were bans on old uses, some of them, there was a proposal that new uses of asbestos could be looked at. So this was to be a continuing and serious problem. So we are the only sort of industrialized country of the world that does not ban this truly hazardous and toxic material. So a very legitimate question is, if we stop the use of asbestos, does that stop disease? And the answer, of course, is yes. For those countries, the first country to ban asbestos was actually Iceland. Sweden was next, and in Sweden, where they have good data, they've stopped it over 30 years ago. The death rates of asbestos-related disease, best looked at by the disease mesothelioma, which is particularly a disease related to asbestos, has gone down dramatically. For those who do public health, we all know that this is something we all understand. Data collection for many diseases is bad. We know that reportable diseases rarely get reported by physicians. I've been as guilty of that over the years for some diseases as others. But the phrase that we appreciate is that the absence of data does not mean the absence of disease. Right now, for example, I have a postdoc working with me in India. The government there for years never recorded a single case of mesothelioma, not one. And I knew that there were cases. One hospital alone had 32 cases in a year. My postdoc went out, and in about 1/5 of the hospitals of India, these were the public hospitals where you could ask for data, in a 10-year period, and not all hospitals had good records, some didn't answer, but in just a small percentage of the Indian hospitals, in a 10-year period, we identified over 2,200 cases of mesothelioma, none of which had ever been reported to the government agency. There are some legitimate questions about the science of asbestos. Is there a difference in fiber toxicity between the amphiboles and the serpentine? In some sense, it really doesn't matter because all fiber types, including the serpentine, cause all the diseases. Fiber size may make a difference. Different fibers have been shown. There's something called the Stanton hypothesis. Merle Stanton was a pathologist at the National Cancer Institute, who I had the privilege of spending some time with and working with. So size may make a difference. And then there's a question of fiber synergy. Sometimes when you mix the two fibers together, there appears to be more disease. There are, however, a lot of contrived controversies. The so-called safe use of chrysotile. The Russians especially, who want to sell their product, say it's a safe material. Yet earlier this year, there was a paper that came out from their big mine showing that their minors get mesotheliomas just like everybody else. That was sort of a interesting new finding. The issue of biopersistence. This is where people say, well, chrysotile dissolves or leaves the lung, so it can't be causing disease. They imply that it leaves the body, which it doesn't. It actually moves more easily to the pleura, the lining of the lung, which is where you get mesotheliomas. And so if you look at those cases, you will find much more frequently, in fact, at least 4 laboratories around the world have shown that 80% of the asbestos in the pleura, and in many cases, in cases of mesothelioma, is exclusively chrysotile. So that puts that to that issue to bed. Controlled use. Countries have all kinds of regulations about controlled use. They're never enforced. Even in one of the strictest countries, Canada, where they had excellent regulations, they actually did a study at 10 work sites, and 9 of them were out of compliance with their regulations. And this is in a very advanced country that cared a great deal about protecting workers. And then an argument, I do a lot of work and have for a number of years, decades now in India. They claim that the Indian genetics is different than Western people's genetics, until I point out that we share 99.999% of our genes. And as our data now shows, which their government didn't collect, but my postdoc was good enough to get, they get mesotheliomas just like everybody else. So there's no such thing as genetic variability. But these are arguments that are made for people who wish to use a hazardous and unnecessary material. When Dr. Montague Murray did this autopsy, he thought about this, and a few years later he wrote, as one sees, one hears, generally speaking, that considerable trouble is now taken to prevent the inhalation of dust, so the disease is not so likely to occur as heretofore. That's over 100 years ago. By 1918, an insurance company stopped insuring asbestos workers because they knew their mortality rates were higher than the general population. This is not a new topic. But yet here we are in 2024, and this is the spectrum of asbestos disease. There's a range of non-malignant diseases, the most important one of which, of course, is asbestosis, or scarring of the lung, one of the many pneumoconioses, such as black lung or coal workers' pneumoconiosis or silicosis, or any number of the dusts that produce lung disease. But asbestosis is markedly decreased now because of better regulations, but still exists, and in some countries is still a major problem. The problem with asbestos, of course, is that it has a wide range of malignant diseases associated with exposure. The most prominent one, of course, is lung cancer, mesothelioma, which is found in the pleura and the peritoneal cavity around the heart, and even rarely, but it does exist in men, in the testicular area. We're going to talk a little bit later, too, about gastrointestinal cancers, esophagus, stomach, and colorectal cancers, laryngeal cancer, various oropharyngeal cancers, kidney cancers, and in women, ovarian cancers. So it is not quite a pan-carcinogen, but it certainly affects a lot of organs, and all of these have been well documented now in the scientific literature. This is what an asbestos mine looks like. This happens to be Asbestos, Quebec. They've closed the mine and given the town a new name. The mine in Russia is still in Asbest in Russia, so we know what they do there. Here's a better looking asbestos body. I would venture to say that everybody in this room has asbestos bodies in their lung and asbestos fibers in their lung. It's ubiquitous in the world. You can find it in the ice cores of the Arctic. You drill down, you can find asbestos because it pollutes the air. You can even show that over the years, the levels have gone up as use has gone up. For every one of these you find in the lung, there are hundreds, if not thousands, of uncoated fibers as well. This is a lung that should be even thinner than this. This is lung tissue. It becomes thickened. This is what a pneumoconiosis is. This is what, under the microscope, asbestosis would look like. Here's an X-ray that the lung tissue should be very dark and sort of black like this, but you see there's much more white down here because this is tissue that has become fibrotic and shows up different on X-rays. This is the pleural thickening. This is a Canadian chrysotile miner. All of this rind around his lung, which is very much compressed, is thickened pleura. Again, not malignant, but very difficult. As I said, asbestos causes lung cancer. The first suggestion was in 1935. It was in textbooks as a lung carcinogen by 1942. The first epidemiology was Richard Dahl, the same gentleman who did a lot of work on tobacco hazards. And he showed that at a particular asbestos textile factory, he had 18 cases of lung cancer, 17% of the deaths from these autopsies when he expected about 4%. So this was the epidemiology that, if anybody still needed it, showed that it was a lung carcinogen. This is a typical lung cancer. It's the same kinds of cancers you get from cigarette smoking, the same cell types. The parts of the lung that get affected are changed a little bit, but that's not really important. I show you this picture of tobacco because there's a very important interaction with tobacco. This was work by one of my great teachers, Dr. Selikoff, who did a lot of work with asbestos. And it was the first example of the synergistic effect of two materials together, or multiplicative effect. If you don't smoke and you don't work with asbestos, you have a very low rate. This is 11 cases per 100,000 for lung cancer. The mortality rate we'll take as a baseline of 1. If you work with asbestos but don't smoke, you have a 5 times increased risk of getting lung cancer. The major cause of death in, let's say, asbestos insulators who worked with this material every day, 20% of them died of lung cancer. 10% died of mesothelioma. 50% of them died of some asbestos disease, something that shouldn't occur in the general population at all. A 1-pack-a-day cigarette smoker has about a 10 or 11-fold increased risk. But if you put the two together, a smoking asbestos worker has an over 50 times increased risk of getting lung cancer. So there's this synergism. The other examples would be smoking and radiation exposure. In the world of benzene, if you also drink a lot of alcohol, you're more likely to get leukemia, for example. There are these other synergistic effects. This is the typical appearance of a mesothelioma. It presents with fluid in the lung, and there's a malignancy under there. We'll talk more about that. You also get pleural plaques or calcified plaques. This is along the pleura. This is on the diaphragm. And this, again, a non-malignant change. Part of the picture of asbestosis. One of my teachers, I trained at the Mount Sinai Hospital in New York. I had the privilege of being in the first medical school class when I opened in 1968, but it had been a great hospital in America prior to that. Dr. Rabin had a single case of mesothelioma, and he reported it, and he looked at the scientific literature and found about 3 other cases that he could talk about. One of the pathologists said there's no such thing as mesothelioma. It's a variant of fibrosarcoma, a different cancer. And so for the next 30 years, they had this friendly discussion of, are there really such things as mesotheliomas? So the Mount Sinai Hospital in the 1930s, 40s, and 50s, 100,000 admissions a year. So that's 1 million people every decade. And in the decade of the 1930s, 40s, and 50s, each decade they had 1 case of mesothelioma, a very rare disease. By the time I was a student there in the 60s and 70s, we'd have 5 or 6 cases in the hospital at any one time. We were a center for studying the disease, but still it now, as the use of asbestos had started in the 30s and especially in the 40s during the Second World War, people were getting their mesotheliomas in the 60s and 70s. In 1960, Dr. Wagner in South Africa reported on 33 cases of mesothelioma from the Northwest Cape province where there was an asbestos mine in a 4-year period. And again, while there'd been reports of asbestos giving rise to mesotheliomas, now everybody said, this is clearly a relationship. Asbestos causes mesothelioma. For his troubles, he was kicked out of South Africa. He went to the UK, and now he got interested in studying asbestos. So here he did some animal studies. And as you see with Canadian chrysotile, he got as many mesotheliomas as he did with, and more than he got with some of the amphiboles. He also got as many lung cancers, pretty much, as he got with the other fibers. So that, again, this idea that somehow chrysotile is safe is not borne out by this kind of study. A very reasonable question would be, well, how much asbestos does it take to cause disease? In this same study, one day of exposure, one day in his rats, 2 lung cancers, 2 mesotheliomas. In my career, between the literature and running into other cases, I know of 5 cases in humans with 1 day of exposure. It's a very powerful carcinogen. And as you see, as you have more exposure over time, you tend to get more disease. Not a perfect curve, but dose response really does work. With lung cancer, I don't know of any cases with 1 day, but this is work from Dr. Solokov's early work that I would work on with him when I was a young student and trainee, and then a young professor with him. A month or less of working with asbestos doubled your risk of lung cancer. And by the time you worked in this factory for 2 years, you had a 7-fold increased risk. So again, very much a dose response kind of relationship. The other logical question is, when do you get asbestos disease? If I get exposed today, do I get disease tomorrow? Well, no. Most human cancers, we have something called the 20-year rule. It takes at least 20 years for cancers, 10 or 20 years for cancers to start showing up. We see a few cases early on, in some countries even less than this, with very, very high exposure, 3 or 4 years. But generally, the peak for lung cancer is out here at about 35 years, for mesotheliomas out here at about 40 and 45 years. So it's a very long latency period to develop the asbestos-related cancers. It's the same thing with cigarette smoking. People smoke starting very often in their teenage years and get their lung cancers when they're in their 60s, 50s, 60s, and 70s. The mechanism by which asbestos causes cancer, we still don't know. That was sort of my PhD work 50 years ago almost. We still don't have a good handle on how it changes the DNA, but we know it does, and there's many lines of evidence, but the exact mechanism is still unclear. So I'm not going to dwell on this, but there are many risk occupations. I'm going to be talking about community exposure today. But clearly, mining and milling, product manufacture, insulation trades and other construction workers, shipbuilding and ship repair, all of these occupational exposures give rise to a lot of disease. I'm going to talk more about these kinds of things. We're going to talk about consumer products and neighborhood contamination and issues of materials out in the community. That's going to be the focus because that's sort of part of the theme of this conference. So, as I said, there are many occupations that are involved, but we're going to talk about community and consumer and general environmental exposure. This is the X-ray of a young man who was 28 years old, presented with this picture. This looks very much like the mesothelioma presentation I showed you earlier. He presented with fluid in his lung. Nobody in a 28-year-old starts thinking of a mesothelioma, especially when this was his history. And as a physician, and for those physicians that are here, you know that taking a history is really the most important part of any kind of medical interaction. He presented with a pleural discomfort. He was found to have a pleural effusion. Months later, he underwent a thoracotomy and was found to have a mesothelioma. Very odd. Had a lung biopsy, and he had fibers in his lung at an elevated level. He died just before his 30th birthday. He had been a bookkeeper, and his university training was as an accountant. He'd never worked with asbestos. How does he get a mesothelioma? This was the fibers we found in his lung. And we did some questioning of where he lived. This was in New York City. Here are these two white dots are where he lived on Wilson Street and Ross Street, next to a naval shipyard. And ships use an enormous amount of asbestos, and it blows out into the community. And so he had his exposure as a baby when he was born, living next to a site that used asbestos. One of Wagner's cases of mesothelioma was in the wife of a miner. We'll talk more about that in a minute. But he also found one case of somebody who lived in the village that the asbestos was passed through who had no other connection. This is not very far from Philadelphia. It's about 30 minutes away in a town called Ambler, Pennsylvania. It used to be called the asbestos capital of the world. They had multiple factories, and they threw these piles of waste that are 30 meters high, 30-meter waste piles of asbestos waste that the local children would play on. Now they've got it covered with dirt and grass, but it also, not surprisingly, has one of the highest mesothelioma rates of any location in the United States. Community exposure. The same London hospital that Montague Murray worked at, Molly Newhouse in London, looked at cases of mesothelioma in the hospital records. Between 1910 and 1965, she had 76 cases. About half of them were in workers who worked with asbestos, not surprising, but 9 were in relatives who lived with a worker, community exposure, and 11 lived within half a mile of the factory. So it's not just shipyards, but it's textile factories and it's mines and it's other facilities where the material blows out into the community, and one has to be concerned about that. Where it says no known exposure, you really can't believe that, because these were old hospital records and nobody was asking about exposure to asbestos or not. In Finland, where they've closed their mine, in the county that had a mine, 6,300 x-rays, 499 had pleural calcifications. In a county with no mine, 7,100 x-rays, not a single community pleural calcification. And then what about products? Somebody gifted me this some years ago. I've passed it on to somebody who has a big collection of asbestos products. Leak-proof asbestos roof coating. So there were 3,000 to 5,000 products made with asbestos. This was back at our laboratory. This is one of our technicians. The label, it's a little hard to read, was a wool coat that had 8% asbestos in it. And you could brush the coat. Some of these are wool fibers. Sorry. Some of these would be wool fibers, but some are asbestos fibers too. So the people who cut the cloth to make the coats and people who would wear it and the dry cleaners who would clean the coats would all potentially be exposed. Children were exposed because they sold asbestos waste for making papier-mâché materials in schools. So the asbestos head. This was a product that was sold years ago to fireproof your Christmas tree. Throw asbestos on it instead of worrying about it catching on fire when you didn't use asbestos. And this is perhaps the most ironic one. A brand of cigarettes used an asbestos filter. Think of that. You could get a puff of your carcinogen with every puff of your carcinogen. And then as a physician, I've prescribed drugs for patients all my life. But in America, until they banned it, they would filter it through asbestos filters. And so when I'd be injecting my patients intravenously, intramuscularly, whatever, I'd be injecting asbestos into them too. So we've talked about the lung and what comes in there. But I'm going to spend a few minutes now about the water problem, because we can ingest asbestos too. All right. Everybody agrees that asbestos can cause, pleural changes, lung cancer, and so forth. There's still some controversy, but the data is really now pretty irrefutable that it causes GI tract cancers, esophageal, stomach, even small bowel cancers, which are very rare, and large bowel rectal cancers, kidney cancers, and oropharyngeal cancers. And you can find asbestos in all of these tissues. Asbestos, when looked for, has been found in the tissues, and it even has the ability to cross the placenta. Stillborn babies, never took a breath of life, who could have ingested or rather inhaled asbestos, we know it crosses from the mother into the developing embryo. So the routes of entry are, how does it get to the GI tract? Well, some of it we just swallow. I mean, every time you breathe, you also swallow things. It gets in saliva and you swallow that. It gets cleared from the lung and gets put in the lymphatic system and ends up in other tissues. And it goes directly via the diaphragm or through the bowel wall into the peritoneal cavity. In addition to the usual inhalation route, there can be ingestion by water, and that raises this issue. A major use in the past and a major use now is in asbestos cement products, including water delivery systems. The biggest use of asbestos today is asbestos cement. Roofing materials in many countries, which should be replaced with safer materials, but also asbestos cement water pipe. In the United States, by 1973, we had 200,000 miles of asbestos pipe. We now have over 600,000 between the United States and Canada. That's over 1 million kilometers of asbestos cement pipe that leaches asbestos into our drinking water on a regular basis. How much is in Europe? I don't know. I've consulted some in Great Britain where they have a problem. The French are interested in this. I don't know what use has been made here in Albania. Asbestos cement pipe has been used around the world, as you see in all of these countries, and I believe causes a much more significant problem than people recognize. The pipe not only is a hazard to the people that make it, but it has a lifespan of 50 to 70 years, but pipes break, and so the people who repair it have to be exposed when they do so. I've seen plenty of disease in workers who either have put pipe in or taken pipe out. And the United States is the only country in the world that has a regulatory level, and it has suggested getting rid of AC pipe. It's the only country with a regulatory level, which was pretty arbitrary, of 7 million fibers per liter in 1992. They did studies. Sometimes they would find a few 100,000 fibers. In some water systems, they would find over 1 billion fibers per liter in some water supplies. In North America, 45% of cities had significant levels of asbestos, as you see, as high as 2 billion fibers. And exposure comes from putting it in and taking it out. And my last comment is, if you look at the World Health Organization commentary, they sort of poo-poo the idea of asbestos cement pipe and say it doesn't appear to be a hazard, but they have not done a literature review for a while, because they would now find that that is also a significant hazard as well. So I thank you for your attention, and thank you.
Thank you very much, Professor.